Well, really what was important for me to share with all is how do mobile operators contribute to personalized medicine. And I think we are playing a strong role. We are an enabler, so clearly we are just part of the team. But we are clearly supporting two things. One, which is the collection of massive data, which is requested to build personalized medicine. And the second point is bringing the information to people and helping them take the right decisions. Because in most cases, what is difficult for a patient is not to decide if he wants to take his treatment, be reminded. It's really helping him cope with the difficulty and bring him the right support. And as a mobile operator, we in fact get strongly involved in both points. One, which is collecting data. Most of the medical devices are getting connected and are really supporting data collection in a massive way. And we also, because we are a personalized device, we are also really supporting bringing the information to each person. Yeah, well, you're right. Standardization of the data is really key. And there, in fact, we also play a role. Within the GSMA, we have initiated a body called Continua. And the role of Continua is to do exactly what has been done between mobile networks to make sure that it all works together. Continua is really promoting standardization in healthcare. So that's something which is really key and where we can contribute to. I think the two other points will be working together to find the right business models, because at some point that's really key. And also just learning to work together. I think we are just there. It took a while for each party to understand how they could contribute to the other. I think now we are in a very interesting stage. I took the example of patient support programs. What I see is that today everybody is realizing that this is really key to support patients and that this can be achieved through digital applications. We are still at the stage where technology and each player from the healthcare industry are talking to each other, which is great. But I think for me the next level will be when all the players will come together and not having hospital, big pharma, health insurances and patients themselves develop each of them one patient support program, but having all those people working together. And because we are at the center of that, I think we can contribute to bringing people together. Well, I see several opportunities. Clearly, early diagnosis is really key. I think anything which can be done to increase the role of the patient, empower them, is also very key, because we see that medicine is very complex and the role of the patient is extremely key, especially in chronic disease management. So for me, that's one big area. Of course, we are very much involved in big data or just simply how to use healthcare data to improve the services, the support, and the prevention. I think it would be great to move into a more preventive healthcare market, and this is one direction we are taking. And clearly anything that will contribute to having much more personalized medicine, including prevention, is a key driver, and there will be a lot of opportunities on that.